A pre-event massage is usually no more than 10 or 15 minutes and is done on the day of the event. One thing to keep in mind is sports psychology. And I know that we aren't sports psychologists, we can't do that, but as a massage therapist, you're there and you can be their greatest cheerleader. A lot of times athletes can get nervous, so to instill confidence, to be very positive, is something that you definitely want to do. Now, in terms of the body, we're going to be looking at increasing circulation to stimulate the nervous system and to get them ready for the event. One technique I like to use a lot, and I don't want to show it in the course too much because it'll just get tedious and boring if I do, is to use the flats of your hand and just go along in any area. You can use it for tapotement and then transition into these types of stimulatory techniques. Another great thing you want to do is to increase range of motion in the joints to decrease stiffness and to also do a lot of compressions to increase blood flow. A post-event massage is administered immediately after the activity, and the goal here is to reduce lactic acid buildup and to increase range of motion in the joints again and to decrease tightness and stiffness in the muscles. Some good techniques here are muscle approximation, which is to bring the muscle together to decrease any spasming. Some nice circulatory flowy strokes, nothing too deep. And then also compressions are really nice here too to increase blood flow. This is another thing that is great for athletes, and it helps them psychologically to get ready and to prepare them for further training and to get them ready for the next event. Strain counterstrain is a type of passive positional release that was developed by osteopathic physician Lawrence Jones in 1955, and its aim is to decrease connective tissue tightness by bringing the client into a certain position for 90 seconds to 3 minutes. During this technique, the tissue is brought into the direction of ease, which helps to decrease spasming. So any tissue or any inflammation that's caught in that tissue is allowed to dissipate locally, and then you could flush it out with some nice effleurage afterwards. Following this release, there's an immediate reduction of pain and tension in the tissue involved. The relaxation from this is meant to restore normal joint mobility and to allow the tissue to regain more length and ease of movement. It's gentle, it's painless, and it's very effective. It's something that we're going to be exploring during this course. Muscle energy techniques are a type of manual therapy in which there's a gentle isometric contraction, which allows for reciprocal inhibition and eventual lengthening of the muscle, as compared to static stretching, which a manual therapist does all of the work. This technique is one that I really love to use. Once again, it's gentle, but extremely effective. I like to do a 10-10-30 system and repeat that 3 times. So get them to contract for 10 seconds, relax for 10 seconds, and then stretch or bring the tissue into a stretch manually for 30 seconds. Activation release techniques are used to treat muscles, tendons, ligaments, nerves, and fascia. The goal here is to restore free and unimpeded motion of all soft tissues, to release entrapped nerves, vasculature, and lymphatics, and to reestablish optimal texture, resilience, and function of connective tissue.